Good morning. Today I am going to do a video presentation on the topic of cognitive behavioral therapy and its usefulness for treating anxiety disorders mainly in the USA. I would like to start by giving some brief introduction about it. Cognitive behavioral therapy is a psychological treatment which helps the clients to understand that their feelings and their thoughts has an influence on their behavior. About 18.1% of population that was in the 2018 in the USA suffered from anxiety disorder, which is 40 million adults aged 18 and older. And some of the factors responsible for these are genetics, brain chemistry, personality, and life events. Similarly, this therapy has proved to be effective for treating different kinds of mental health illness, depression, anxiety disorders, and family relationships. Now, moving to some of the research questions, there are three major research questions that I have picked up, which are how this therapy works, or how this therapy is useful for treating this disorder. What are some of the practices or strategies that this therapy involves? And finally, what are the implications shown by this therapy? Now, in the literature review, I'm going to talk about some of the practices or strategy that this therapy involves to treat this disorder. And the first is the hearing out client's life story, the problem that they are facing, and clients' life values, as values shapes the thoughts and the feelings and the behavior pattern of the person. And in a broad form, this therapy helps the persons or clients to deal with this disorder by allowing them to re-examine, figure out, and reconstruct cognitions, distorted cognitions, that is their beliefs, their thoughts, and their intolerance is examined, and how they overcome their fear is the most important thing in this, and this will automatically help to build up positive thoughts, acceptance in them. And in the second part of this therapy, the most important part is the homework task in the second part of this therapy. And this therapy works by recordings in which the clients are asked to record some of their feelings or their thoughts, and most importantly, the experience of the exposure in the situation in which they fear the most, or they avoid, or they try to avoid the most, that are recorded, and they are submitted to the